Hi Candace, this is John. I finally got some time to respond to your email, so I'll get right into it. I think I'll just talk about universal health care in general, and I think we'll wind up answering some of the specific points that you bring up. Excuse me. Now, of course, nothing is free, and universal health care will be no different. It will have to be paid for somehow. And if it's paid for by the public sector, that'll mean taxes. Now, you argue that the money we're paying in premiums will be replaced by taxes. Now, I don't think that'll be necessarily true because in these countries where you have universal health coverage, many people still pay their taxes, and then they have to purchase additional coverage outside that system because what the government provides them for their tax, in return for their tax dollars, is not sufficient to meet their needs. But let's say it were to be 100% true. Premiums would be replaced dollar for dollar by taxes. You still have certain factors that push taxation higher than premiums would be. Of course, the private insurance companies have a bureaucracy that takes your money and then doles it back out to providers. That results in higher costs of services because you're not paying the provider directly. You're paying the provider, plus you're paying somebody to do paperwork and things like that. Now, that system would have to be transferred 100% over to the government system. We're not going to all of a sudden pay our provider directly. We're going to go through the government. The government's going to collect our money in the form of taxes, and they're going to pay those providers and things like that. But the difference is that you would have the same bureaucracy and set of providers and under the government system as you would have in the private system. But in the government system, you would have to have an additional bureaucracy just to collect the money in the form of taxes from the citizens. So you have to spend, anywhere from 102, 103, 105, 110% of what we spend as a nation now on premiums, on taxes, just to have the same amount of money going into the system. So that's one area that pushes the taxes higher than what the premiums would be. Now, we know that countries that provide universal health coverage, almost all of them have higher marginal tax rates than we do here in the States. And we can't say that that is automatically or necessarily because they provide universal health coverage for their citizens. But there are a few reasons that I think the universal health coverage they do provide to their citizens is a great factor in the fact that they have higher tax rates. And I'll tell you what I mean. If we're replacing premiums with taxes dollar for dollar, we already have the additional bureaucracy that will have to be added that will make this more expensive. But you also have a couple of additional factors. Everybody talks about how insurance premiums and healthcare costs have risen exponentially over and above the cost of inflation lately. And that is true. The main reason that happens is because we have this system here in the States where rather than paying for cash, employers are incentivized to offer benefits in the form of non-cash payments. So you have things like insurance coverage and things like this that are provided for by your employer. They include, what I call blanket coverages. They include procedures that you would normally pay cash for. And so you have more people coming and using their insurance for services than they otherwise would. This creates upward price pressure because you have, more people in the system. You have a blanket coverage where you use almost your insurance for almost every medical thing you can think of. The government insurance program would even exacerbate this part of the problem worse because now instead of even 95 or 99% of these things being covered by private medical insurance companies, you would have 100% of your medical needs provided by this blanket insurance program that the government would set up. So you would have more people in the system, higher pressure on prices to go up because you have more people in the system, more not even more people, but more procedures being covered, and things like that, where every medical need you would go through the government system for. The other thing is the efficiency of the private companies versus the inefficiency of the government-run system. Private companies that operate on profit are incentivized to keep the number of bureaucrats down, to investigate people that are making fraudulent claims and keep those expenses out of the system. A government agency that is going to continue to exist, regardless of profit or loss, will not be nearly as incentivized to keep fraud out and to keep the number of bureaucrats and the inefficiencies down. Every cent or dollar that the private companies save in this manner is profit. We know they're greedy for profit. So it actually winds up weeding some of these things out that the government system will have no incentive to keep out, and that will drive prices up. The other thing is competition. Insurance companies have to compete. There are 20 insurance companies I could name you right now that would love for me to pay premiums with them instead of with their competitors. So they have to offer a set of coverage, a set of programs that will first of all be beneficial to me, but anybody can offer the same set of coverages. So what they have to do is compete with one another on price. This is another element that drives prices down. The government system, when you eliminate the private system, will only have one provider of these coverages, of these services. There will be no incentive for them to offer you a lower price because you won't have anywhere else to go. It's like the phone company that services all the telephones in a certain area, and the law says only this provider can provide telephone service in this area. The price goes up because there's no incentive for them to bring the price down. And of course you get bad customer service along with that too, so because you can't go anywhere else. But that's another issue. We're talking about changing premiums into taxes dollar for dollar, and these are reasons that tax money will have to go higher than the current premiums that we're paying right now, and that is the competition. There will be no incentive for the government to keep our premiums low, in the form of taxes. So these are things that the private system is incentivized by profit, and also by the nature of the mechanism to weed these things out. And government, and that will save money on what they'll have to charge us in taxes. The government, or what the private companies have to charge us in premiums, the government will have no incentive to keep these same types of things out and save that money on our taxes. I believe wait times are an integral part and a function of government-run healthcare systems. When you have this blanket coverage, like I mentioned, where everything is covered, and not only is everything covered, but some people that aren't paying at all are covered, and it's perceived as free. What happens when they give away pizza at the local car dealership? People just show up. They don't really want a car, but they show up. When everything's free, people run into the system to get the benefit that they think their dollars are paying for, when they don't necessarily, or they would have otherwise stayed away. Even with the blanket coverages that we have in these insurance packages, you still have to at least pay $20 or $40 copay. When something's absolutely free, you have people coming in that would have normally stayed away. So that floods the system. That creates a need when you have the same amount of doctors and you have additional number of people coming into the system, or even when you try to compensate with additional doctors. You're flooded, and the only way to make sure that everybody's treated equally is to create a wait time.